Today in their matchup against the Chargers, the New York Giants lost Malik Nabers to a right knee injury, which would require him to be carted off of the field. Currently, it looks like we have an update where NFL insiders believe that he has suffered a torn ACL, but he is going to have a closer look at this injury tomorrow with an MRI. We'll take a closer look in a moment at the injury replay, but it looks like that right before he goes to jump to try to catch a pass, we see that right knee just cave inwards in a very awkward position. This awkward position is very consistent with something known as a dynamic knee valgus, which is a very, very risky position for the knee. If you've seen some of my videos in the past, you've heard me talk about this. So what we're going to do today is we are first going to take a look at that injury replay more closely. Then we'll go over the dynamic knee valgus position and break down biomechanically what's happening at the lower extremity. Finally, we'll go over the relevant anatomy as well as the best and worst case scenarios here. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. I'll also talk about the relevant anatomy for those injuries as well as the rehab process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. As we take a look at the injury replay, we see that as Nabers is going to plant with that right leg before jumping, this is the moment that that right knee caves inwards. As he returns to the turf from being airborne, he is immediately grabbing onto that right knee. So let's elaborate on that dynamic knee valgus position when we see that knee cave in. Basically what's happening here, there are several things happening at the lower extremity, which biomechanically will put someone's knee into this position. The first thing, the femur is going to go into a position known as adduction or adduction, where it's going to move towards the midline. As we make our way further down, the knee is going to get an abduction moment or abduction, meaning that it wants to move away from the midline. And as we go further down, the foot and ankle are going to go into an eversion position. Usually the person is also going to be in a position known as pronation or where the foot is going to be flat-footed. As I try to take the model through that dynamic knee valgus position, so we're going to cave the knee inwards, we're going to internally rotate the femur and externally rotate that lower extremity. As I'm doing this, this is putting a lot of stress going through that ACL. So absolutely, when we see someone's leg go into this position, we immediately are concerned for an ACL injury. It can also lead to any sort of injury to that MCL as well as the medial meniscus. At this moment, we don't know whether those other two structures are implicated in this injury, but that big one is going to be the ACL. Of course, tomorrow when he has the MRI done, that will confirm if any other structures are implicated. The ACL is highly involved in preventing any sort of anterior slipping or frontward movement of that tibia away from the femur, as well as giving the knee a rotational stability. So the dynamic knee valgus position, what it's doing here is you're getting a lot of excessive torsion and rotational force going through the knee. If it is too much, it can absolutely lead to an ACL injury. This snapshot of his right lower extremity before he is going to jump looks like he is just going into this classic textbook position. Because the ACL is going to prevent that anterior translation, basically they're going to do a Lockman's test on any person that has suffered this type of an injury. Basically, they're stabilizing the femur and pulling on the tibia or pulling that lower leg away. They're feeling for laxity and they are comparing it to the non-injured side. Let's say they do this and they feel some laxity. It makes them think that they're dealing with an ACL injury. You can also do something that's known as an anterior drawer test, a little bit of a different position, but what we're doing is we are still pulling that tibia going away from the femur. These tests are not always 100% accurate, but it is a quick assessment tool that we have if an MRI machine or basically an MRI is just not available at the time of injury. The MRI tomorrow is going to look at every single structure that is located in the knee. The absolute worst case scenario here is going to be a full ACL tear, which is consistent with a grade 3. A grade 1 is where we're getting stretching of the ACL, and a grade 2 is where we're getting partial tearing. A lot of times partial tearing does not require surgery, but it depends on if the person has a lot of laxity in the knee. Usually this clinical presentation is going to determine whether or not they're going to have surgery. The rehab process for somebody that is non-operative for an ACL injury versus somebody that has fully torn the ACL and has had a full ACL reconstruction is going to differ greatly. So we're going to be on the lookout for the results of that MRI tomorrow. As soon as I see the result of that, I'll be sure to post that in the comment section. So based on what we have currently and the biomechanical position that we see Malik Nabers' leg go into before injury, I would unfortunately have to agree that this is a highly risky position for the ACL. We hope that it is along the lines of a lower grade injury that does not require surgery versus that worst case grade 3, which will require that ACL reconstruction and sideline him for the remainder of the season. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.